it brings it back to that personalized aspect. There are things that you can present sort of globally, but not everybody's going to do it, and everything is not appropriate for everybody. And then there's sort of the individual thing. So I think that's why it's so good to be able to give that individualized one-on-one attention, such as individual coaching.
Welcome to this week's episode of Roots of Healing, a Vishuddha production. I'm Dr. SiriChand, and I am delighted this week to invite into the podcast Dr. Minako Abe. She's the Lifestyle Medicine Director and Vice President of the Tokyo Cancer Clinic. She is an amazing lifelong learner. She attended UC Berkeley and earned her MD at SUNY Stony Brook and has dual U.S. board certifications in emergency medicine and lifestyle medicine. After practicing in New Jersey for over 15 years, she found that nearly 80% of emergency room patients were suffering from conditions really linked to lifestyle choices. And so she realized that she wanted to get more involved earlier with people, and she began incorporating lifestyle medicine into her practice, probably little bits here and there as we're going to learn, and ultimately now has had the opportunity to move to Tokyo, Japan to work in cancer immunotherapy, helping them thrive and not just survive with cutting-edge immunotherapy treatments, and really bringing in that holistic mindset of lifestyle, coaching mindset, looking at the whole person. So welcome, Dr. Abe. Thank you so much for joining us. Tell us a little bit about your journey. What an amazing transition from emergency room all the way to part of this really innovative clinic in Tokyo.
Right. So I loved emergency medicine, and I still love emergency medicine, and it's definitely a very needed, very integral part of medicine, and we need people to take care of people in, when it's most needed. But I did really find that after working for 10, 15 years, that most of my patients, what they were here for and what they were being treated for could have ultimately been prevented. So I figured we really needed to start work upstream. And so much can be prevented by lifestyle, whether it's, infections or heart disease or strokes. And so, that's what really got me interested in lifestyle and how much we could prevent, rather than putting a Band-Aid over something,
Right.
If we could just prevent them from getting to that point at all.
We have sort of an array of listeners I'm anticipating. The podcast is still in its infancy, but I know we're going to have younger trainees and particularly women who maybe are questioning how to maintain their own vitality, their own health. Was your discovery into lifestyle medicine also part of your own personal journey, or did it come really as much for the patients first?
Oh, definitely a part of my own journey as well. I think it is so important to try and balance your needs and balance, you can't be a good provider if you don't first take care of yourself. And in a way, that was what attracted me to emergency medicine in the first place, because I figured when you're on, you're going 110% really hard. But when you're off, you don't have to, back in the day it was pagers, you could put your pager on the shelf, and you didn't have to answer any phone calls about your, long-term patients. So that part of it, intrigued me, and that attracted me to emergency medicine. But it is really hard. It's hard on the body, it's hard on the mind, it's hard emotionally. And so I found out that if I didn't balance those really hard days with taking care of myself, whether it was going for runs, eating well, connecting with friends, then it really was a one track, leading to burnout, which I think all of us in our careers tend to suffer from. And I was definitely quite crispy by the end of my emergency medicine career. And I really realized that, I really needed to take care of myself.
One of the things that I've always appreciated, so my background is internal medicine as a PCP, and it's fewer and fewer internists that are PCPs. And of course, we get a lot of the inpatient training, and we see a lot of advanced disease. And I really appreciated how our ER colleagues were sort of really good primary care doctors first, in a way. You didn't have that continuity, but ER gives you exposure to so much. how far into your career did it start percolating for you that, gosh, I'm really seeing the advanced elements of people who haven't gotten the care or the support or the advice they needed? Did it take a while to notice that, or was it really clear to you right out of the gate?
That was pretty clear to me right out of the gate because I was practicing mainly in New York City.
Oh, right.
Right. And a lot of people didn't have primary care physicians. So the ER was their primary care.
Right.
And so we would, even though you don't think of ER doctors having, continuity of care, we actually did see the same patients over and over again. You would treat them for their asthma, but they were back the next week.
Yeah.
I think we had to sort of cover the bases. And then we saw people sort of really at the, end of life and, end stage, alcoholism, drug abuse, a lot of these things, which, unfortunately, I feel like a lot of it could be prevented.
And I one of the things that really drew me towards the lifestyle medicine community is sort of this shared ethos that earlier interventions actually alleviate suffering and improve health span. And though it would seem so clear, it's not really available in most specialties, which sort of leads me to this podcast, because a lot of the conversations I've been having have been with, advanced career clinicians, people really deep into their careers, 20 years, 15 years, well out of residency, seen a lot, experienced a lot, and really came to this conclusion that they had to step out of the corporate insurance-based model. And I'm going to be curious to hear how insurance works in Japan, but to step out of that model to really give the type of care that they felt aligned with their values and the outcomes that they wanted patients to see. And I feel like doctors are sort of put in this box right now. The doctor didn't do this for me. And it's not always the doctor's wishes either, that certain features of your care. So tell us a little bit about what did that transition look like from ER to Tokyo? How did that opportunity come to pass? And did you just have a day where you were in the car and you were, okay, tomorrow comes my 6 months? Because I think in the lifestyle community, we're going to see more and more people that are going to be asking, how do I create a good opportunity for me to really do medicine this way? Because it's so aligned with who I thought I would be as a doctor.
Right. So, and again, I don't want anybody to, who loves ER to necessarily leave, because we need good ER physicians. And I think, being in the ER, the one good thing, you're being employed by a hospital, but just by virtue of being in the emergency room, you can't turn away any patients, right? So we treat everybody, whether they're the CEO of a big corporation or if they're a homeless person, you treat them 100% equally. And, do the tests that are needed for that patient. So we're a lot less restricted by having to get pre-approval for certain tests, and we do what it takes to treat the patient. And the luxury is that we don't really have to think about the costs. Unfortunately, those costs do have to be absorbed somewhere, whether it's the hospital, whether it's the patient, but we do what is needed. So that was kind of a luxury that I didn't have to think about that piece of it. And you were just 100% there for the patient. My transition to Japan is, a whole nother story, but I'm originally from Japan and I moved to the United States. I lived in the States when I was little. And so English is my first language. And then I returned for university and then stayed there until I moved back here just 10 years ago now. But so my family's always been here. And my father is a physician here, and he had been researching and developing really fascinating cellular immunotherapy for cancer. And so he's been trying to get me to move back to Japan and help him with his clinic. He's getting older now. And then finally I thought, I was really burnt out of emergency care. And I felt like even though I was giving 110% of myself, people were just it was a rotating door. You sent them out and they were back the next. next week. And, no matter how many Band-Aids you're putting on the wound, the underlying causes were just not being addressed. And just being in the emergency room, it's extremely busy. You don't have that much time to give your patients, even though you try and, give them little nuggets here and there. And because it's a good opportunity in a way. When they're in the emergency room, it's typically because they're at some sort of a crisis point, a breaking point. And so I think the words that we give them as physicians at that very vulnerable point can stick with them. So they're here with a heart attack. You say, okay, this is a really good chance to turn your life around. You're here. You're being given a second chance to really make a difference in your health and your life. And so I think from that standpoint, it's a really wonderful thing to have that lifestyle medicine background to be able to give that back to your patients. And it's at a critical point when it makes a difference in their lives. But that said, like I said, it was, I had very young children at that time, and I wanted them to be able to experience, the culture in Japan and the language. And so we up and moved my entire family here, and it was a really good thing. It's been fascinating. Again, 180-degree shift from what I was doing before. But especially with cancer, cancer is also, a preventable illness. They say 30 to 50% of cancers can actually be prevented. And also cancer patients are very at that vulnerable stage where they want to know, what can I do to improve my chances? How can I make sure my immune system is actually functioning correctly in order to help fight against the disease? And there's so much that can be done, in lifestyle medicine, in their nutrition, and how they sleep, how they de-stress, how they sleep. All of these things help improve your immune system and are, a really good partner, work synergistically with all the treatments that we're giving. So that's sort of how I found my niche now. I'm trying to bring lifestyle medicine to Japan and also to spread that and to treat patients, in a more holistic manner using all the modalities we can.
That's so inspiring. I'm just curious, how has it been received by your Japanese medical colleagues? Is there an openness, a curiosity? I'm just curious, are these things that may have been in place culturally? So people think, why do we need reminders in medicine? Tell us a little bit about how these differences between the two countries exist.
Right. So, it's all across the spectrum. And people talk about Japan, well, everybody lives a long time there. Everybody is healthy there. There's no obesity problem in Japan. So yes, I think that in a way that lifestyle medicine, or just what we think of lifestyle, has always been a part of the culture and has been embraced. Everybody knows that, the whole, walking 10,000 steps a day. I mean, that actually originated in Japan with the sales of the first pedometer, like way back in the day. And, it was an arbitrary 10,000 steps just because it sounded good at the time, and it kind of stuck, and it's turned out to be, pretty accurate. And in terms of, the diet, there's always been a very open culture about, making sure that you have a very balanced diet. It's the Blue Zone Okinawan diet was always very plant-based, and everything is natural, and you wanted a good balance of foods. And I think that traditional diet, has definitely been a part of the Japanese culture. Nowadays, in the last, 20, 30 years, of course, the diet has become more westernized, and you also see the rise of type 2 diabetes, the rise of cancer, and, all sorts of chronic illnesses that, are considered to be lifestyle illnesses. So I think a re-education is kind of needed, and, going back to basics. And so far, I find that, Japanese clinicians and the culture as a whole has been very receptive. I just actually had a big conference that was a lifestyle medicine conference in Tokyo. And it was really, really well received, I think. And that people are starting to realize the value of sleep. People work really hard in Japan, and, sleep ends up being on the back burner. So between that and diet and, exercise. It's really been a game changer, and people are extremely receptive to it. And, lifestyle medicine as a whole in the United States has been a thing for the last 20 years and growing stronger every year. And I think we're just starting that, and it may be in our infancy in Japan, but I think that also is sort of a growing movement, which is fantastic.
What a beautiful experience it must be to be re-inspiring what is the natural traditions. Sometimes certain people are messengers or the visionaries that say, hey, let's remember the roots of what makes us, the culture, healthy. I was really curious when you said, because we think about the 6 building blocks of lifestyle medicine, and we've reviewed them on the podcast, being 150 minutes of exercise, whole food, plant forward diet, 8 hours of restorative sleep, meaningful community, removal of harmful substances. And I always forget the last one. I know there's one more in there.
Social connection?
Social connection, right.
Yeah.
And so I was curious. So we know in America that isolation, diet, sedentary, this really heavy qualities that the American obesity epidemic, metabolic dysfunction has sort of shown us. But I'm really curious about what you said about sleep, because I think we don't appreciate the health value of 8 hours, 7, whatever's right for one's body, 6 to 8, or even a little longer. So you're finding that's sort of an important place to start with a lot of the people you're working with, is understanding that we can't work a 18-hour day and expect to sleep 8 hours. There's not even enough math for that.
Right.
Has that been difficult to kind of work? Because that's perhaps, I don't want to jump to a conclusion, but maybe that's a cultural belief that one needs to work that much, and maybe health is okay to sacrifice. So sometimes meeting those cultural beliefs through coaching or through mindset or just through data, saying, hey, look, your health span will be this if you sleep and this if you don't. Has it been a little bit challenging to meet a really strong cultural belief?
I think, up until the last 5 years or so, it was extremely, it's not machismo, but it's like, you're not a hard worker if you're not spending, 12-hour days at the office or 15-hour days at the office. And, sleep was definitely on the back burner. And back in the day, it was very much the Japanese business culture that after work you had to go out and drink with your bosses till late at night. And, that was, and if you didn't do that, you weren't a good employee. And, it's like being the first one in the office and the last one out of the office. That was, showing that you were really a good worker, productivity aside. I think the one benefit from the COVID pandemic actually was that people were kind of forced to stay at home and people got more sleep. And I think people actually realized in a way that there was a benefit to that. And especially knowing that your immune system is really compromised when when you have lack of sleep. And I think that in a way may have started, this trend. And I do see like in the news stories, and it's becoming more and more common knowledge. I think that, good sleep is really a foundational key to part of your health.
I recall, and of course this is off the top of my head, but as I've journeyed through all of my primary care years, that shift workers often have increased risk for, the ones that come to mind are breast cancer. You might be able to correct me here. And it's probably some corollary for men that I'm not sure what it is, but
yeah, prostate and colon.
Yes, right. So that's a really curious thing to me that people, because we're going to dive into cancer here in a moment, but what a curious thing to appreciate that, we say we work ourselves to death. And, sometimes people don't do the math on that A, B, C, D. It can equal a very serious life-ending or life-limiting illness. And particularly for healthcare workers who are doing a lot of shift work and trying to understand, we're going to have some sleep experts coming up on the podcast. And we're going to talk specifically about how the shift workers can adapt but also just recognizing, like you said, that not sleeping enough doesn't allow. One thing that has always struck me is that the sleep experts all say, we know sleep's important, but we're still not totally sure what's happening when we sleep. Like, what are the mechanisms that the body is refurbishing itself, so to speak, or replenishing itself? So really appreciating your insight about the pandemic and how that translated to perhaps a cultural shift because people felt better. I mean, there's nothing like feeling better to understand how we were doing it wrong in the first place.
Absolutely. It's just sort of like there's nothing like getting sick to appreciate when you're well and, realizing how much you take for granted when you are feeling well. And I think that's the same with sleep. And for me personally, like that's one of the top pillars, that I always prioritize because I'm like a person that just does not do well with sleep. So it was hard for me as a shift worker for, 15 years and having to especially flip your days and your nights around. And, it is such a needed, I think, field in terms of research, like because we, in today's world, this is our world. And there are people who do have chronotypes that do better at night, so to be able to use that and, what works for their body. And I'm certainly not a night person, but, a number of mechanisms that definitely impact your health is number one is your immune system. That's when your immune system gets activated at night, especially something called your dendritic cells, right? Your dendritic cells are the ones who actually get out the antigens and instruct your T cells on what specific cells, like cancer cells, need to be fought against, or bacterially infected cells. So those cells get activated at night. Our natural killer cells, which can naturally, without knowing the specific target, can recognize infected cells and cancer cells. Those actually really get activated at night, so much so that there's been research to show that just one night of sleep, from like a 7 or 8 hour sleep to a 5 hour sleep, can decrease the activation of your natural killer cells by 72%. And that's just one night. I mean, that is crazy, right? So if you think about chronically underslept people, your immune system really is not functioning at its top ability. Right. So, that in itself is really critical for cancer because your immune cells constantly patrol your body to look for abnormal cells or precancerous or cancer cells. So it can get rid of those cells before they actually take hold and start multiplying and become a big tumor. So, sleep is paramount, especially for cancer. And also, obviously for any sort of infections. Why do you want to, sleep for 12 hours when you have the flu, right? Your body wants to recover. And also, for things like Alzheimer's disease, right? That is huge. And especially in Japan, it is such we have a very aging elderly society. And they're saying by 2025, up to 30% of the population over 65 will actually have some sort of dementia. And that, socially, I mean, I don't know how we're going to be able to care for all these people with dementia. My mother actually suffers from dementia, and it is so much work. It is, to be able to care for these individuals. And I just don't know how, as a society, we're going to go through it. But how sleep plays into that is that while we sleep, in our brain, the rest of the body, we have a lymphatic system, right? So we have, our immune cells are working overtime during that time. It's draining our lymph. It's trying to get rid of our metabolic waste. But our brain and spinal cord, we don't have a lymphatic system there, right? We just have our cerebral spinal fluid that's kind of flowing around. But during deep sleep, our glial cells, which are sort of the infrastructure of our brain, those cells, they shrink down by 60% to create space in the brain so that our cerebral spinal fluid can actually flow around sort of like a washing machine, like a dishwasher. And so during our deep sleep, our glial cells shrink down. The cerebral spinal fluid can actually flow around and wash out all of that metabolic waste that's accumulated through the day in our brains and in our spinal cord so that our brains and our nervous system can continue to work well. And when you decrease that amount of sleep, they've done spinal taps on volunteers, very brave volunteers. And just by decreasing their sleep, they show that the levels of things like tau protein and beta amyloid protein, the proteins that are associated with Alzheimer's disease, increase because our bodies, when deprived of sleep, we're not able to clear out all that metabolic waste. So,
wow.
So yeah, so the sleep is
You're
very
giving
important.
a very convincing argument for sleep. And one of the things that is so amazing that people sometimes don't always think about is that your primary focus is in immunotherapy and cancer. However, we're recognizing that these pillars of lifestyle medicine fundamentally inform all the systems of the body to be more proactive towards health. So it's health promoting in every system. It's like it fills the kidney buckets, it fills the cardiovascular bucket, it fills the circadian rhythm bucket, it fills the neurohormonal bucket, the mitochondrial bucket, the microbiome bucket. Like there is no bucket that's not beneficially impacted through these 6 pillars. And we begin to see that through these discussions. So that is so cool. I didn't know any of that. And that's really exciting to understand better how sleep is so important.
It is so amazing. I mean, our bodies were, we evolved to be such, intricate, amazing creatures that, our bodies have all of these systems in order to keep us healthy and to maintain. And it's when things get out of balance, I think, that, illnesses start to appear. And we do have ways of, fixing ourselves if we give it the chance. Not saying that everything can be fixed by our bodies, which is why we need allopathic and, modern medicine.
Right.
But to be able to use, we have so much that's within our own control, and I think that's what's most empowering about lifestyle medicine is like these things, are ours to control, and we can, optimize what our body can do. And then if you need it, when you need it, then you depend on other, innovative medications and treatments that, we've developed over the years.
I think one of the things not everyone knows about me is that I took 3 years off to study the traditional healing system of India. It's called Ayurveda. And one of the reasons I did that, because this was before lifestyle medicine was here, this would have been 2008 when I went to India, was that I felt like we didn't have any skill sets to return people to health. I trained at Mayo Clinic. It's a very formal place where there was advanced therapeutics, but the lifestyle pieces were never integrated into our treatment plans. And I sort of felt when I finished, like, how do we preserve health? I mean, okay, that's preventative health, but we don't get any of that concrete training. Of course, we could go on about nutrition, but we didn't get any sleep training. We didn't get any stress reduction training. We got what happens with sleep apnea. We got what happens once you're insulin resistant. We got what happens once depression and anxiety are deeply set in. We got what happens to help someone quit smoking. And there's all these places that lifestyle medicine can come in. So I took these 3 years, and there's a beautiful sutra that comes from the old textbooks that says something to the effect of the purpose of medicine, not just as we think of it now, but this would have been thousands of years ago, is to protect the health of the healthy and return those who don't have health to health. I've always loved that. And when lifestyle medicine became available, I was so excited. I'm like choked up thinking about it because it's so exciting to me that we can bring these theories forward. I would love for you to tell us, because some listeners just may not know, what is cancer immunotherapy? What does that exactly mean? And why would this be important for someone to know about?
Yeah, I'm really excited to share this with you because this is also a field of medicine that was not available to me while I was in the United States even. Cancer immunotherapy, most people think of cancer immunotherapy and it's a big umbrella, right? are different drugs, right, to help our immune system, enhance our immune system into attacking the cancers. And what I do here is actually a little bit different. It's actually using your own cells. It's part of regenerative medicine. So what our patients do is they come to our clinic, and obviously there's a whole evaluation, and we try and be as holistic as we can in our approach. And the treatment itself is not medications. It's not drugs. We of course want them to do the surgeries and get the chemotherapies and the radiation and whatever is available to them. But this is a little something different. It's something in addition to. And what it is we take their blood, we draw their blood, and from their blood sample, we isolate out different immune cells. So we isolate the natural killer cells that can naturally recognize cancer cells in your body, and we take it to a lab. We have a certified regenerative medicine lab where we isolate the natural killer cells and grow them to the billions. And then, it takes about 2 weeks or so to grow them to that level. And then we return them to the body by giving them an IV. And so you have, those extra activated natural killer cells in your body to fight your cancer. And then the other treatment that we do is called a dendritic cell cancer vaccine. So it's a live cancer vaccine. And I talked about the dendritic cell a little bit earlier, right? These are super special cells that can recognize certain antigens on the surface of the cells. So antigens are basically proteins that are on the surface of cancer cells. So in our bodies, we have very, very few dendritic cells. It's less than 0.4% of our circulating white blood cells. Most of our dendritic cells, they live just like on the surface, like just under the surface of the skin, right along the surface of the gut, because they're like the number one barrier, basically, from the outside world to the inside world. So if you get a big cut in your hand, right, and there's some bacteria there, the dendritic cells will come there to look at those antigens, and they'll say, okay, we want to get rid of any cells that are infected by that bacteria, right? So then those cells are the ones that talk to the fighting T cells, and then those T cells multiply and they go back and fight the infection, or they fight the cancer. So going back to what we do is we take the blood, we have to create the dendritic cells by taking out their precursors. They're called monocytes. So we take out the monocytes from that blood sample, we grow that into the billions, and then we transfer them and turn them into dendritic cells. And then we feed those dendritic cells the antigens specific to that person's tumor. So if somebody is a breast cancer patient with HER2 positive breast cancer, we can feed it HER2 antigens. Excuse me. If they have colon cancer, colorectal cancer, and they have high CEA, we can add CEA to those live vaccines. If they are a prostate cancer patient, we would add PSA to those. So we actually create an individual vaccine for that person. So when they come in, we draw biomarkers to see what biomarkers are elevated, because two people can have the same cancer and their biomarkers are all different. So we actually create a live vaccine that's specific to that patient, re-inject that into the patient while we give them the natural killer cell. Through the IV, we actually give them a live cellular vaccine. And because it's their own cells, you're not going to react and have the same ill effects that you would as a chemotherapy, which is, essentially a poison designed to kill your tumors, but also can kill your healthy cells. So these are targeted cells, cellular therapy that fight against your own cancer that's created from your own immune system. So wow, this is like an amazing treatment that, I would love the world to know more about. We do have patients that come from all over the world just to our clinic so that they can receive this therapy, because it's not available in the States or in Europe and most parts of Asia.
There's so much to dive into with that. And what I love about that is again, it comes from my own Ayurvedic background, but there's a notion of cellular intelligence. It doesn't really translate to Western terms, but the idea of using one's own cellular intelligence to amplify a response, it's sort of like, is the belief in this system, this is me just being curious, that there's an impairment, or that the cancer has sort of overcome the natural mechanism, or is it a little bit of both?
Definitely a little bit of both. And I love that phrase that you said, because it really is our own cells' natural intelligence. I 100% believe that, they don't have a brain, but the mechanisms that our body has evolved to fight invaders like cancer and, bacterial infected cells. I mean, it is an extremely intelligent system. And, I think cancer takes hold because the cancer cells, too, in its own evolution, are trying to evade the natural mechanisms that we have in place in order to attack it. Right? It's been shown that every individual, like every day, we have like 5,000 epigenetic changes or mutations that happen in our body on a daily basis, right? Because as our old cells are being replenished by new ones, mistakes are made. And some of those mistakes are precancerous or cancerous. These changes occur, in cells in our body. It can sometimes evolve to try and evade those mechanisms that our body naturally patrols to get rid of those cells. So, we sort of have to stay on top of everything in order to continue. And that's why a lot of cancer patients have to go through one drug. And then when that drug stops working, they get switched to another drug. But we do have these innate natural mechanisms. So it's like to empower those mechanisms to continually fight, a changing cancer or tumor. So I think
it makes so much sense, to be quite frank. I'm curious, without wading too deeply into it, I have to give a backstory. So in between college and med school, I did a stint at NIH looking at cancer research. And I know that it can take a long time to bring a new therapy in the US. Do you anticipate this being something that could be available in the US at some point? And what makes the Japanese regulatory process more flexible to allow something that is rooted in innovation and, from what I'm hearing, probably lower risk of harm than the chemotherapeutic classic agents?
Right.
I'm just curious what kind of discussion surrounds the therapies, in terms of their ability to be viable and approved in the US, and how is it that Japan is so open to it when the rest of the world isn't?
Right. So, at the moment, there is one dendritic cell vaccine that is on the market, and it's been FDA approved in the United States, but it's only for prostate cancer. And, that's been on the market since 2017. But since then, there's been kind of a stalling of cellular medicine, I think, in the United States. There are many clinical trials that are going on sort of to combine cellular immunotherapy with certain drugs, because a lot of the
funding,
research and the money that's behind research is, with the pharmaceutical companies. And part of this is like, it's not an off-the-shelf treatment, right? So each treatment is made individually for that person. It's very labor intensive, a lot of, time and hours in the lab, and it's not something that can be scaled and mass produced very easily. So I think that's been one difficulty for this type of treatment to take hold in the United States. And I really have to praise the Japanese government in a way that when regenerative medicine became a thing between, stem cell medicine, PRP, cell therapy for cancer in Japan, in order to try and develop this and become, a strong foothold, globally, they created their own sort of regulatory body just for cellular medicine. So we actually have to go by not just, the regulations that govern a clinic, it's also regulations that govern cellular medicine. But in a way, by doing so, we were able to, actually clinically provide this without going through a lot of the hoops. It is not a treatment that is covered by national health insurance. We do have national healthcare in Japan, which, I think is very good. It makes, healthcare very different from, what we experienced in the States. There is good things and bad things in it. But unfortunately, the regenerative medicine is not something that is covered. Right. So we have, a fee-for-service type of model in our.
It's really exciting to hear about this, and we'll certainly link information to your clinic for people to explore more. I think getting the word out is really relevant, and certainly, I'm a visionary and a scientist, so I love that you all are sitting under a regulatory process or an investigative process on your own, sharing your discoveries. I mean, when it comes to healthcare, there can be a level of excellence that maybe isn't everyone's priority or perhaps even fully accessible, but it's so valuable to think about this innovation informing really individualized, personalized care. And that's so exciting to me to hear about this and to think about it as a resource. You shared with me a beautiful published abstract here, Personalized Medicine Universe. That's a lifestyle medicine coaching in patients with cancer, a case study. So what I absolutely love is that the clinic is not only bringing in this incredible innovation at the cellular level, it's giving one could say epigenetic benefits or the overall lowering of inflammation, which we're not even totally sure what that technically means, but we get a gist of it. Tell us a little bit about this case of a woman with stage 4 renal carcinoma with metastatic lung disease.
So one of the things that I really wanted to bring into our practice was the ability to coach patients, because, most of us know what the healthy things to do are. It's just a matter of getting there. And like I was saying earlier, that especially with cancer patients, they're feeling very vulnerable. They have their own unique challenges. Like, sometimes their taste is not, what it used to be. So things that were delicious to them in the past, they just can't even stand the smell of anymore. And a lot of that has to do with the medications they're on and the treatments they've been on. A lot of them are really, if they've been in the hospital or if they've been under really difficult treatments, they're having a hard time getting out the door and getting movement back and integrating that into, part of their lives. So I really wanted to be able to help people and talk to people about their lifestyle and how I can help them so that they can incorporate these things and start to feel better, even if they're undergoing, the harshest of treatments. So we do the lifestyle part of it, how can we help you right now, as well as the mindset, because as you can imagine, being faced with an illness like cancer, that is really, really difficult. And so being able to provide that sort of coaching. In the particular case that I wrote up as a case study, it was with a young woman who had stage 4 renal carcinoma. She had big metastasis to the lungs. And so she was having a lot of weight loss, right? And, with cachexia of metastatic cancer, because cancer is metabolically active, it takes up a lot of your calories, and weight loss is a big issue. So she was really feeling weak and not able to do much. So we said, okay, well, out of, the 6 pillars of lifestyle medicine, what is the number one priority right now? And it was with her diet. So it was being able to get enough calories into her to maintain the strength so that she could start feeling better and actually start to do the things. She used to be a runner and she could barely make it around the block. So, we started by working with her, counseling her on food and nutrition and getting enough calories. And then once her weight started stabilizing, then we were, at first it was just getting enough calories to sustain her. It didn't have to be perfect. Not everything she was eating is on, the list of things I would recommend for cancer patients, but, just getting her stabilized. And then from there, she was like, okay, I'm feeling better now. Now I can focus on what I'm eating, not just getting the calories in. And then once she started feeling better with that, she was like, oh, I'm feeling strong enough. I can actually start moving more. So she started with, doing just at-home exercises, some, 7-minute video exercises, walking around more until she slowly got, was able to start walking up the hills and taking longer walks. And then, that in itself makes you feel better. And that also, improves your immune system between, eating well and having good nutrition and exercising. Exercise is one of the most key things we're learning more and more about. It prevents your cancers from metastasizing. And there's some really good data to show about how not only is your immune system able to go into the tumors to attack them more when you're exercising, it provides this wonderful microenvironment in the actual tumors. It's just, your circulation goes up, your inflammation goes down. So I see inflammation as that your immune system is so distracted by this chronic inflammation, whether it's in your gut or, in joints or whatever, that it can't focus on the things that it really needs to focus on, such as attacking tumors. So, so we, worked on diet, then we worked on exercise, and, we made sure that she had a really wonderful network of friends and family around her, that she could really get that, de-stressing, the emotional piece. And she ended up doing really, really well. So that's how I try and help patients with coaching alongside the immune cell therapy.
When you explain it, one has no problem with saying, of course, why would we not do that? But I worked in hospice for many years in addition to primary care, and boy, the gut and motility and all these pieces, loss of taste and the metabolic weight loss that comes from cancer. I'm curious, how do you, as the vice president in the clinic, how are you inspiring your team to approach a lifestyle-focused approach to patient care? Was there a little pushback, or has there been an open receptivity to it?
Yeah, I think, I don't push my thoughts or agenda on anybody unless they want it, because people aren't going to be interested unless they know about it, right? But people aren't going to do anything personally unless they want it. So it's not like, can I tell you, but what do you want to know about? What are you interested in? Even that's how I approach my coaching classes. What are you interested in changing? What will cause the biggest bang for your buck? Is it quitting smoking? Is it, bettering your diet? Is it, trying to get, 7,000 steps in a day? What is it that you want to do? Because if they don't want to do it, then they're not going to do it. Even though we know what's good for us, we don't always do it. So, so in terms of, spreading my message and, motivating, patients in my clinic or our staff, I try anyway. I'm not perfect at all, to lead by example, and to try and get the message out, through social media and through giving talks and motivational talks, just to get the data out there and try and get people excited and adopting that approach for themselves.
Yeah, it's so true that it is a devastating time for many people, a vulnerable time. I even just this week saw a Facebook post about a clinician who was facing a cancer diagnosis and just saying, what lifestyle measures can I do? And my response was, find someone who can work with you. Don't ask in a Facebook group, because lifestyle is so uniquely rooted in our beliefs about ourselves and our cultural backgrounds and our bandwidth. And coaching, many of the guests who have been on the podcast have had a coaching background, because we recognize that behavior change is rooted in, complicated aspects of self, whatever neurologic pathways are predicating the ability to change, all the same. It can be quite hard. Many of us know how to do better, but it's hard without the support and the data and the assurance of a clinician who sort of, I love mature clinicians, because they're people like you are using wisdom. It's this combination to me of intuition and knowledge, where these things, but intuition is informing you, saying, got to do food first here. And when I was young in my career, I'd be like, here's the 80 things I'd like you to go home and do. And people would come back and they'd be like, I did none of it. And you'd be like, why not? Oh, it'd be so great. And did you watch this movie? Did you buy that book? Did you listen to this podcast? And I'd send these elaborate emails and people would get back to me and be like, well, I tried one thing on your list. And then I realized like, it does have to be these smaller, intuitive, wise counsel. And so this also takes a higher touch, a more, than what the standard systems really allow for a lot for is this continuity and the therapeutic relationship that comes from a clinician who is sort of watching and supporting and coaching. And I think that's really powerful. Do you have a hope for lifestyle medicine and coaching to be part of a global mindset around cancer treatment? I mean, I'm sure you would like to see the dendritic vaccines be more integrated into care, but perhaps that will be a longer journey. But this lifestyle piece, are you presenting and sharing outcomes and hoping to influence in a global way? Because I love that for you.
Yeah, I definitely have hopes for it. And what you were saying was also, it brings it back to that personalized aspect. It's like there are things that you can present sort of globally. It's like these are good for everybody, right? But not everybody's going to do it. Not everything is not appropriate for everybody. And then there's sort of the individual thing. So I think that's why it's so good to be able to give that individualized one-on-one attention, such as individual coaching. And I think that's the same for just our medical systems in general, right? If you think about a country having to provide care for all of its citizens, it is so hard to be able to do that one-on-one thing, which is why there are these sort of algorithms. You have breast cancers. Okay, we test for this, this, and this. And if you're this type of breast cancer, then these are the drugs that you get. Or these are, we go from, biopsy to surgery to radiation to these medications. So you do have to have sort of this global overall way of treating patients. But I think the frustration comes from when you are that patient, and sure, for the majority of patients, maybe, this algorithmic approach works for 80% of the patients, but then the 20%, they're like, okay, well, I'm following the algorithms, but I'm not getting better, and especially for those patients, it's like you want to be able to think out of the box and to provide them with that one-on-one specialized care, and to support each person, in the way that you can best support them. And, I think the wonderful thing about lifestyle medicine is you don't have to wait for somebody to tell you what to do. Plus, as a patient, you don't want to be really told what to do. But we can provide them with the information. Okay, from all the good data that we have out there, we know that, the cruciferous vegetable family, with the broccoli and the kale and the Brussels sprouts, like they contain sulforaphane, which is an anti-cancerous, compound. So it's like that is, information that we can share with everybody. It's good to eat your greens. Good to increase the fiber in your diet, right? Because 70% of your immune system lives in your gut. So you want to, feed them the good, healthy fibers that are going to keep your immune system healthy. There's the macro level and there's the micro level. And I think we need sort of that hand-in-hand approach to be able to provide the best care for the most individuals that we can.
That's I love the heart of service that you bring to this. And I'm sure we could do a whole other podcast on the internal inquiry that's taken you, not as much scientific pieces, but the process you've had within your own journey. We're going to start to wrap up. I could just keep going, but I'm mindful of our busy clinicians' time. Do you have any advice for a young clinician who maybe already identifies as someone who wants to do lifestyle, but maybe has student loans or isn't clear? What kind of advice would you give 5 years out of residency you?
Right. I would say that, lifestyle medicine, it's not just, even if you wanted to be doing lifestyle medicine 100% of the time, and it's not possible now, I think lifestyle medicine is like a foundation for everything. lifestyle is foundation for all of us in order to maintain a healthy, sane kind of life, especially 5 years out of training. I'm sure you're very, very busy. You're still learning stuff. You're still working really hard. But it's like if you don't incorporate that into your own lives, then you're going to hit burnout really quickly, right? And you can bring lifestyle medicine into any field. So you can be, a nephrologist. Lifestyle medicine is extremely important in that. You can be a neurologist. You can be a psychologist or psychiatrist. I mean, it's really foundational for all of our fields. So whatever field you're in, this is something you can incorporate right now in your daily practice, in yourself. And, I hope that lifestyle medicine becomes, just a part of just
medicine, just
overall
good
medicine. Yes, exactly.
I'm so delighted to have had this hour went so quick. Like I said, there's so much we could share. Could you give us your website? How would someone, if they had a loved one, without going, again, being mindful of your time, maybe give us a minute or so of who would be appropriate to reach out? It could be everyone. It could be specific profiles and where they might find the ability to reach out to you.
Right. So I try to stay pretty active on social media. So you can find me. I'm Dr. Minako on Instagram, LinkedIn, Facebook. Just Google me. I have a YouTube channel. I have a few videos out there, just informational videos. Best way to get in touch with me if you're interested in the immune cell therapy that we do, or the cancer coaching that I do, is just directly at my clinic. It's Tokyo Cancer Clinic, one word, .jp, since we're in Japan. And you can feel free to email me or get in touch with me through there.
And as I understand it, you also offer a free Monday motivation newsletter. So if our listeners were interested in that, we can perhaps include a link for them to sign up. I think it would be so interesting to know what's top of mind for you, because you're really in a very cutting edge field and also bringing compassion and human connection. And even just through our conversation, I can feel the response that you all seek to cultivate within the clinic environment with so much wisdom and really innovative science. What a delight to talk to you today. And I'd love to welcome you back at some point in the future to explore even more what's coming down the line. Thank you so much for joining us.
Thank you so much for having you. It's been a pleasure.